It's like you're healthy, you think you're healthy, and then the next day you're not.
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist Health Talk.
Hi, everyone. I'm your host, Johanna Gomez. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about breast cancer and why you shouldn't wait to start thinking about it, as one of our next guests learned. We are joined by Dr. Starr Mautner, breast surgical oncologist at Baptist Health Miami Cancer Institute, and Stephanie Rico Masterson, a breast cancer survivor. So, Stephanie, I'm going to start with you. You were in your late 20s. You weren't even 30 yet when you were diagnosed. Tell us about your story.
Yes. So I was diagnosed at the age of 28 with metastatic breast cancer. And it was a very actually exciting time in my life because I was newly married.
Wow.
My husband and I were just about to celebrate our 1-year anniversary and finally be able to experience a true honeymoon. And so it was, again, like just very, very weird because we were excited, but also I was feeling, like pain under my armpit.
Okay.
And we realized that it was going longer than expected. Mm-hmm. And I'm a pediatric nurse and I carry a lot of trays. So we thought it was like, maybe I'm carrying too heavy trays and stuff like that. So it was weird, but at the same time, very important for me to obviously listen to my body. Mm. And we knew that something wasn't right, but we were like, there's no way that this can be something,
right?
Because it's like, I'm so young.
Absolutely.
And we were like, let's go get it checked out. And that's when we sought medical advice. And then it went, right. It went from there.
Did you feel a lump? You just felt pain under your armpit? It was just
pain. Yeah. I actually never felt my breast lump.
Okay. Dr. Mautner, we hear a lot about women younger than 40 being diagnosed. Why? Where? Is this like some new, is there like a new study that can pinpoint exactly what is going on? Is it environmental? We hear so many different stories.
Yeah. So actually this has been looked at, and since 2004, the rates of young breast cancer have been increasing in the United States. There was actually a large study published in the Journal of the American Medical Association in January of 2024 that kind of tried to elucidate the reasons why. And while a lot of it is still unknown, there appears to be a cohort effect of women that are born during those years that are actually developing more breast cancers. And I think that the reasons are multifactorial at this point. We can't pinpoint one exact reason why. It appears to be due to a multitude of factors such as late childbearing, lack of exercise, increase in alcohol intake. Genetics definitely play a role, but I also see plenty of young, healthy women that don't really have strong family histories of breast cancer that are also developing breast cancer in their 20s and 30s. And you just feel that there must be something else going on.
Absolutely, yeah.
I noticed this in my own patient population. I've been working at Baptist for the past 10 years. And over a 10-year period of time, I am seeing increasing numbers of women under the age of 40 being diagnosed. It used to stand out when you would see a woman, in your clinic under 40. And now it's like almost on a daily basis. When I'm in the office, I am seeing someone 45 or younger being diagnosed with breast cancer. And so it's just becoming much more common.
Yeah, I think a lot of people think, well, it's not genetics. I don't have to worry about it. It's not in my family history. So I'm just going to shrug it off.
Or
right?
I'm too young, like it's not anything.
Yes,
right.
or I'm too young, but it's just way too many stories to see that. You're saying genetics, really don't be fooled by that. But what do we do if you feel the pain or you're not over the age of 40, you can't get a mammogram? What should we do?
So if you're feeling a change in your breast, whether it's a consistent pain that continues to occur and you think something's not right, or whether it's a lump, the first step is to go to your either primary care physician or gynecologist and say, listen, I think something's not right, and demand imaging, because just because you're under 40 doesn't mean you cannot have a mammogram. It just means that it's not usually recommended as a routine screening test. But if there's something wrong, then we work it up. We don't just ignore it, because it could be the difference between life and death. If it's Stephanie had just ignored that lump and let it grow for, over a year, her outcome would be very different than it is right now.
Yeah, Stephanie, to go back to your story, tell us what happened after you were diagnosed, your treatment and that journey.
So when I was diagnosed, we obviously had to put the honeymoon on pause. Mm-hmm. And it was just, I truly don't remember it because it was a blur.
Yeah.
It was like from one day I was waking up, going into work and coming home to having, dinner with my husband and, like a glass of wine because we were so excited, because we were about to turn 1 year anniversary married. And then the next day it was like my life changed completely. It was like we had to think about infertility to be able to preserve my eggs so that we can have, a chance of having a family in the future. I had to have a port placement surgery. I went to go see Dr. Mautner, and it was like we had to come up with a plan. I had imaging. It was just, there was so many things that happened.
It kind of feels like a bad storm that you're living in.
From 1 second, you're right. It's like you're healthy. You think you're healthy, and then the next day you're not.
Yeah. So did you have chemotherapy? Did you have radiation? How long was that process?
So I've actually done it all. We went through IVF first. Then I went through 6 rounds of aggressive chemotherapy. I had a liver ablation in between.
Wow.
I went through a double mastectomy with reconstruction and 28 fractions of radiation.
Okay. I read that you did proton therapy.
Yes.
What is that, Dr. Mautner? Can you explain what that is?
Sure. So proton therapy is a type of radiation therapy. And basically radiation therapy is one method that we use to treat breast cancer. But many patients require either radiation therapy and chemotherapy, or maybe none of that,
So
or one or the other. It depends on the tumor. It depends on the patient, depends on the stage of the cancer. And so when we choose a treatment option for a patient, it's not just a one size fits all. It's a very personalized treatment plan. The type of cancer that Stephanie had used targeted therapies, immunotherapy, chemotherapy, radiation therapy. But proton therapy specifically is a type of radiation, which is high energy particles that are used to kill tumor cells. And in traditional radiation, we use photons, which can scatter. And while it kills the tumor cells, it can also damage healthy tissue. When you think of the breast, it's near the chest, right? And so you have the heart, you have the lungs, you have a young woman who you need to radiate, and you really don't want to damage the heart and lungs because long-term that can have effects like heart disease. And so proton beam radiation therapy is a unique tool that we have at the Miami Cancer Institute that is called like pencil beam radiation, where you can stop the proton, you can stop the radiation at a specific spot so it does not scatter. So it's very precise, it's very pinpoint, and it's just as effective as photons, but with less damage.
Is this fairly new?
Protons have been around for a while, and we've had them open since MCI opened. So many, many patients have been treated in this way. But a lot of patients are under the misconception that protons are always better. And it's not always the case. Many patients don't qualify for proton beam radiation because they don't necessarily benefit from it. It's not something that we use on every breast cancer patient. But when you see a young patient who's had a mastectomy that requires chest wall comprehensive radiation, you really want to limit scatter as much as possible. And so in this case, proton beam radiation was the right treatment for her.
Could it be that you can just do proton therapy, not do maybe chemotherapy? It just all depends.
Yeah. So it depends on the goals of treatment. So when we talk about chemotherapy, that's very different than radiation therapy. Right. Radiation's a local therapy to the chest wall, to the skin of the breast, to the lymph nodes. But chemotherapy is usually given intravenously. It's through the whole body. It's considered systemic therapy. And it's given to patients that have a high risk of spread to areas outside of the breast and lymph nodes. So in Stephanie's case, there was evidence of spread outside the breast. And so that was one of the reasons she required chemotherapy. But another reason a patient could require it is for an aggressive tumor subtype, such as triple negative breast cancer or HER2 positive breast cancer. And so once again, not only is the choice regarding chemotherapy personalized, but the type of chemotherapy. So someone who has a triple negative breast cancer lacking the receptors for estrogen, progesterone, and HER2 will get a different chemotherapy regimen than someone that has a HER2 positive breast cancer.
Yeah, I've spoken to a lot of women and they like to say, well, you didn't do this and I'm, and it's like, it's
every
all
story is different. Yes.
Yeah, every story is different. Speaking of stories, you brought up IVF, something a little personal. How did it go with fertility? That was probably top of your minds, as you said.
So it actually wasn't, because again, you go through this diagnosis that's like it is a life or death situation. Yeah. And the last thing I thought about was infertility until I had the conversation with with my medical oncologist, and he told us that like we needed to, go through chemotherapy before starting treatment. And it was really scary to just think, that so many things were taken away from me. I dreamed I feel like every woman dreams to be a mother, and to be a parent. And so I'm a pediatric nurse, and every single time I was working, the patients' families and like my coworkers would be like, "You're going to be an incredible woman." And it just it would stab me in the heart because I never knew if I had the chance of being a mother one day. So we went through IVF, and it was honestly the best part of my whole entire cancer journey, because we were able to record it. We were able to, enjoy the time, giving myself the injections, and it really truly was probably the best.
And you had to
most
obviously
rewarding.
do this prior to going through therapy?
Correct.
Okay, so it was pretty. Right. It was quick.
It was very quick.
Everything must have moved very fast.
It was very, very quick. And it was my only chance.
And go ahead and tell everybody the outcome of it.
So I am so grateful to say, thankfully to all the incredible physicians at the Miami Cancer Institute, that I am a mother.
Yeah. You're giving so many women that are watching and listening right now so much hope. Yes. Dr. Mautner, is it possible that it's not just Stephanie, but maybe someone else that's watching or listening right now to continue life, that there's life after this and light at the end of the tunnel?
Absolutely. And that is part of our protocol. When you see someone who's premenopausal diagnosed with breast cancer, while it's difficult to start thinking about preserving fertility when you're getting a cancer diagnosis, it is one of the things that you really need to start talking about early on to know your options, because as Stephanie said, she had to make that decision very quickly before starting treatment. Now, not every single patient will need chemotherapy before surgery, but sometime early on in that journey of cancer treatment, if you are going to be receiving treatment that can affect your fertility, whether it be the chemotherapy or something called endocrine therapy that blocks estrogen, you need to make a decision about if you're going to preserve eggs or embryos. Some people don't have a partner to preserve embryos with, so they're just preserving their eggs. They don't know what the future holds. In general, what we recommend is to wait 2 years before trying to get pregnant after a breast cancer treatment and diagnosis. There are many methods to be able to conceive after breast cancer treatment. Some people use surrogates. And while that's a very expensive option and not one that every patient will have, that is one that can be safely done within the 2-year period if you don't want to wait or you don't have the time to wait for that period to be up. Some patients require their treatment to extend obviously beyond 2 years, and they're on treatment that their medical oncologist does not recommend stopping to try to conceive. And so those patients would need to look at other options. But in general, it is safe to get pregnant after breast cancer treatment if you wait that 2-year period. And I always recommend having that discussion, obviously, with your physicians and your medical oncologist before stopping or halting treatment to try to conceive.
Right. We, as patients, we always want to know, what is the cause? Why?
Right.
Why did this happen to me? I think that's the first thing. What did I do wrong that led me to this path? And you must have a lot of emotions when you see a lot of patients come in, all age. Doesn't matter, right? We all go through those same stages of finding out when you have cancer, what it's like, and processing that information. What would you say is the biggest thing that you say to us patients that you don't want us to ignore, that you want us to really pay attention to?
So that's a great question. And it's very frustrating to see these patients that we can't pinpoint a cause, right? Yeah. Only about 5 to 10% of patients diagnosed with breast cancer will actually be found to have a genetic mutation that caused their cancer, like the BRCA1 or BRCA2 gene. So about 90% of patients, we can't pinpoint and say, aha, it was your genetics that caused this, whether or not you have a family history. So a lot of the risk factors for breast cancer are not modifiable. Being a woman, right? Getting older. Those are the 2 main risk factors. Family history. You can't do anything about
those. No, it's inevitable.
Right. There are a few that we can do something about, and they're so easy, and patients often look over them or forget them. So one is exercise, and the second one is avoiding alcohol. But that being said, most patients are like Stephanie. They weren't excessively drinking, and they were probably exercising and eating a healthy diet. So it's hard to say that it was one thing that a patient did wrong. And I would never say that to a patient, because you're not going to place the blame on the patient. And it's not their fault that they developed breast cancer. But now that you have this diagnosis, what can you do to prevent recurrence? What can you do to stay healthy? Avoid alcohol, continue to exercise daily. And when we talk about exercise, really what's recommended is a moderate amount of exercise for 100 250 to 300 minutes a week, or vigorous exercise for at least 75 minutes a week. So this is like a prescription to exercise, right? It's not like, oh, go for a 15-minute walk. You're probably doing enough. Like, this is real exercise. And everyone needs to do it. I try to practice what I preach, but it's difficult to find the time. It's hard, but you have to invest in your health, and how much better is it to exercise and prevent something rather than have to take medication or treatment later on.
That is good advice. And I'm going to note that when I don't want to work out and I'm just in that slump that happens to all of us to get me going and off of the couch. I have one more question for you. How aggressive is breast cancer with younger patients? Do you see that a lot? Yeah.
So we know that breast cancer in younger patients is more aggressive. And we see that because they present with higher tumor stages, many times because they're not screening, right? They're coming in when they can feel the lump already. And so you know that it's a little bit more advanced than if you're just catching it on a screening mammogram. But they tend to have more aggressive subtypes too, like triple negative, like HER2 positive, and larger tumor size, more spread to lymph nodes. And so notoriously younger women develop more aggressive disease, and they're treated more aggressively because of that.
Yeah. And I think a lot of times we're scared to say, go ahead and be an advocate for yourself and feel yourself and touch yourself. Remind yourself every first of the month, because every month looks different, right? When you are in your cycle. So I think we have to just be more open about it and normalize that conversation a bit. Stephanie, so let's end on a good note. How is life now? We know you've got a beautiful baby, but how does it look?
I mean, life is absolutely incredible.
You're so beautiful and positive. I love it.
It's definitely, I definitely do see life through a different lens.
Yeah.
And I feel like I was living life thinking that I was living, checking off every milestone, thinking that that's what life was all about. And I realized that after I was diagnosed, it's all about just living in the moment and embracing every moment. And now that I'm a mother, I just enjoy every second and every ounce of my child. Yeah. So it truly is. I mean, life is, as you know, beautiful. And I'm very, very, very grateful to say that I'm cancer-free. So that's something that, I give thanks every single day.
Yeah. As I get ready to let you both ladies go, we are in Breast Cancer Awareness Month, and we're going to hear a lot. We are going to see a lot. What is one thing that you want us to just keep in mind?
Listening to Stephanie's story and seeing how amazing she's doing, right? And how beautiful she is, and that she has this baby. Stay positive. If you're diagnosed, especially at a younger age, it could feel like the world is coming in on you. I mean, I am in such awe when I see these patients who are either newly married or starting their career or have young children, and then they get diagnosed with a breast cancer diagnosis, and it's just crushing. But the patients who stay positive and have this optimistic attitude, which is just unbelievable, they do well. And it really goes a long way. And I do try to connect my patients together, and Stephanie can attest to this. Like, they become friends with each other and their biggest supporters. And it's so rewarding to see that, because it is helpful to talk to someone that's gone through it, whether their story is the same as yours or not. Some of the aspects are going to be very similar. And I think I do a great job of talking to my patients, but I didn't walk that walk. And so talking to someone that's been through that and be able to kind of compare tips and tricks and stories, I think is really helpful. So there is a support group out there for you. And if you are diagnosed, you are not alone. Stay positive. You're stronger than you know. And a lot of these treatments take weeks to months to a year or even more. But at the end of all of this, a year out, my patients come back looking healthier than they've ever been and living life to the fullest.
Well, as a breast cancer survivor, I'm going to say thank you to you for putting that message out and for doing that, because it is true. We need each other more than ever. And you are a great example of what life after cancer, after going through such a horrible thing, what it looks like. You are that light at the end of the tunnel. So thank you so much for sharing your story. Thank you so much for being here and for sharing your knowledge with all of us. And remember, viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you so much for watching, and be safe out there.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.